Hello everybody, my name is Raul Cortoreal. I will be presenting the case of myxedema coma, how this is the most frequent presentation as a constellation of symptoms, potential contributor factors, exam performed, potential diagnostic and clinic treatment or medication, the patient's current level of stability or instability, and the plan for transferring the patients. Let's just begin with the case presentation. Um, the pre-transfer video report is talking about the myxedema-coma case. This is a patient information that we have. The name is MD, is age is 72 years old, is a female, and a past medical history of hypothyroidism, diagnosed 15 years ago, not complying with the levothyroxine for the past 6 months due to financial constraints. She also has, as a past medical history, hypertension and hyperlipidemia. The case presentation of the HPI that we have, Mrs. MD is a 72 years old female with a history of hypothyroidism who present with a month-long history of increasing fatigue, mental slowing, and swelling of her face and hands. Her symptoms began gradually and have steadily worsened, with a notable decline over the past week, including profound weakness, slowed speech, and increased confusion. According to her daughter, she has seemed more withdrawn and has been sleeping excessively. Cold weather exposure and the recent respiratory infections appear to have worsened her condition, and rest has not provided any improvement. She has not taken her prescribed levothyroxine for the past 6 months due to financial difficulties and has only tried over-the-counter cold medication without relief. Potential contributing factors that we have for this case. We have the long-standing untreated hypothyroidism due to medication non-compliance, a recent upper respiratory infection 1 week ago, and cold weather exposure without adequate heating at home, and also advanced age and multiple comorbidities. Current presenting symptoms: severe lethargy and confusion, slowed speech and delayed response time, puffy face and periorbital edema, cold dried skin, hoarseness of voice, and slow, shallow breathing. She also has presented with bradycardia and hypotension. Those are the current presenting symptoms. The exam performed in clinics, we performed the blood pressure, vital sign, blood pressure is 82/50, heart rate 42, temperature 94 Fahrenheit, respiratory rate 8 per minute, and oxygen saturation 88% on room air. Physical exam, we have a generalized non-peeling edema, hyperreflection, slow mentation, cold extremities. Neurological assessment, we have oriented to person only with a sluggish pupillary reaction. Cardiac exam, we have bradycardia with regular rhythm. Pulmonary exam, we have diminished breath sound, bilaterally shallow respirations, and skin dry, no rashes. Diagnosis performed in clinic, we have a point of care glucose 58 milligrams per deciliter. The ECG sinus bradycardia, oxygen saturation 88%, in thyroid panel and other lab ordered but pending TSH expected to be elevated, free T4 low, and cortisol. The assumed diagnosis that we have is the myxedema coma secondary to severe untreated hypothyroidism precipitated by infections and cold exposure. In clinic treatment initiate, we have given oxygen via nasal cannula 2 liters per minute, IV normal saline bolus for hypotension, passive rewarming with blankets, IV glucose 50 milliliter 50% solution for hypoglycemia, IV levothyroxine 200 to 400 microgram, or liothyronine 5 to 20 microgram loading dose per protocol. IV hydrocortisone 100 milligram stress dose steroid pending adrenal function assessment. Current level of stability, we have a critical, unstable, high risk for respiratory arrest and cardiovascular collapse. Plan for transfer. The immediate transfer to ICU and nearest hospital, continued oxygen and IV fluid during transport, monitor airway closely, intubation equipment ready in case of respiratory failure, maintain continuous cardiac and pulse oximeter, monitoring en route, communicate all clinical finding, treatment initiated, and pending lab result to receive our facility. Prognosis with myxedemacoma is associated with a high mortality rate, 7 to 50%. Older age, cardiac complication, reduced consciousness, need for mechanical ventilation, persistent hypothermia, and sepsis are predictive of mortality. Thank you for watching my case report for transfer to the ER, and see you in the next chapter. Thank you very much.